Hello to all my support fibro friends. What is going on this Friday? I had our early meeting today with advocacy. So we had some meetings scheduled last week with Patients Rising, and we got rescheduled this morning. So shout out to my team out there, Nisha and Estella, for joining me this morning to meet with Congresswoman Judy Chu's office. So I have advocacy on the mind, and actually I went to bed thinking about fibromyalgia advocacy. So that's why I thought I'd just jump on here and do a quick impromptu support fibro live with all of you. And let's talk about fibromyalgia advocacy. Okay, just for introductions, I am Melissa Toller. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. Please like and share this video, especially about getting involved with fibromyalgia advocacy. If you're out there tuning in, please leave us emoji, a comment, let us know where you're tuning in from as well, and just ask questions, because it's a great time just trying to get into momentum of doing more video broadcasts for the network. I put together last night a whole branch of topics and ideas that I'm going to put together for videos. Some of it will be live streamed, some of it will be premiered, and some of it will just be uploaded for you. But if you have topic ideas that you want, or if you want to be a guest and be interviewed as well, please reach out and let me know. But since I have since I have advocacy just in general on the brain, because I've been learning so much about advocacy, I took the Patients Rising master class, their master advocacy class. I'm learning as much as I can so we can improve the fibromyalgia advocacy program, but I definitely need some fibromyalgia warriors out there to join me when it comes to advocacy. So I wanted to talk a little bit about some of the barriers that I kind of hear, because it can be a little intimidating. And I know you may see me commenting a lot, you may see us posting a lot or joining a lot of advocacy meetings. So just to let you know, I am a self-proclaimed introvert. I have no experience in public policy. I went to school and I have a biomedical degree. So I have a science background, but not a public policy background. So intimidation, it was totally intimidating, and you can hear from other advocates that joined us too at Capitol Hill and the virtual. It seems like a lot at first, but after you do it, I've heard from many advocates, it felt so much better. Like it goes really fast. It's very comforting to know that people just share, but it's always, any sort of presentation meeting. I don't know if anyone out there is like pros. I've seen people that just can talk, and I'm not one of those. So I always have my script in front of me, and you just prepare, and that's part of it. But it's important that we really take down the barriers to the process, right? If you've seen other organizations, they're doing their Hill days, you see them out there and you want like something to be involved with, or if you apply and you don't, come over to here, because as an underdog, it's like we embrace everything that we can about this in a learning environment, right? We have team aspects, we want to learn, we'll work through this together and we'll learn together. And that's so important. And shout out to Becky there. Okay, Becky, I want you to join as well. And you have a background. So hey, if you want to ever do a video to like help guide once you join and see what it's all about, I would love it, because we're learning from each other. And that's the big aspect and the big takeaway for all of this, right? We have the strategic plan, we have our asks, our congressional asks that we go to, but the most important thing that we want to do for the fibromyalgia community is just get you involved and show how powerful your stories really are. And to give you an example of what happened with the Patients Rising group, I mean, shout out to Wanda. We met with her representatives on some of our congressional asks that we were going through with the Patients Rising group. And by the end of this, earlier this week, we heard that her representative is actually going to co-sponsor 2 of the congressional asks. So she put in the work. She did the ask. We did it as a team. We supported each other, and things move forward. And I know with fibromyalgia, it's going to take a little bit more time. It's strategic. It's a marathon, not a sprint, but it's important that they hear from all of you and what you're going, and especially people that represent other groups like support group leaders. We've invited them. If you want to bring some of your family members to speak on your behalf, caregivers always can share a great perspective. We've had teams of families, so people speak on behalf of their family members as well, and just that shared experience. So some of the things that you can do just to get involved, we have a form that I posted in the description, and you can fill it out and we can have a discussion. If you're not sure, let's talk about it, and I can walk through some of the process. And it's still going to feel like a lot right away, but reach out to some of the other advocates that have participated, and we've shared pictures, we've shared their information out. They can share from their experience as well, because I know it looks like everything could be polished and seasoned, but we're still in the learning phase and we're still in the growth phase, because we're seeing some difference in increase in funding, or they just updated the NIH report or something like that to get more funding. But we're really searching for this new reclassification for fibromyalgia as a neurological condition. We want to put it to full, but we have to gather as many of you to raise your voice. You can join us in the virtual Hill Days. We're gonna I'm debating right now to how many we're going to do next year. Maybe there's a couple. I think there's going to be one in March. We might do a full encompassing training in May. So we're still trying to put it together based on logistics and dates, because we are working to launch another program, Project Echo, next year as the medical education piece. And there is some component of legislation involved with echoes too. So we are strategically moving forward with that. But I would love to know from all of you, just get involved. What are your questions? What do you see as your barriers to getting involved? I know many of us have a set amount of time and energy that we can dedicate to this, or maybe it's not, we're not sure. And so please definitely ask your questions as much as you can, and you'll be seeing us promote fibromyalgia advocacy more and more. And you've seen our videos with the A team, Crystal, Estella, and Juana. So we did a video recently, and we'll have more video updates for you on what we're doing and the outreach. And again, there's been a lot of advocates that have worked with us virtually. So I just wanted to just, come on here and kind of chat a little bit, because we're going through the process of where it started with our organization. So we launched in 2019 in September. We did have advocates join us in person to take the meetings in person in Washington, D.C. I'm not exactly sure when the in-person meetings will return. I love the hybrid aspect. I love meeting virtually. It's kind of nice. And I've been going through some more ideas to make it more effective with technology that I want to really try to implement. So right now I'm planning it out for next year. And then just, doing it virtually. So virtually, you get as presentable as you can in front of the camera, and introduce yourself. You're matched up with your different representatives and your state senators, and you start to share your experience related to fibromyalgia. We have some asks that we would like you to present in the meeting, and we kind of go through it. And that's what we've done. 2019, we did it early in 2020, and then again this past year in 2021. So in May, we did a virtual meetings. It was fantastic, but a little bit chaotic on the virtual side. So we'll get better at that and just organize more things. But it it does take energy even virtually, because you're just, it's quick. Meetings get quick. You do your ask, you introduce, you may have multiple people in the sessions that you introduce, and then you move to the asks. People share their experiences related to that. But it's a good experience to connect with other advocates, and that's what it's all about, and trying to make sure that you feel empowered in this community and you feel that connection. I think sometimes too, when we notice different connections to things, like stuff gets put out to get involved, but the follow through is a little strange. Or you fill out a survey and you don't know whatever happens at the end of the survey. So what we're trying to do at Support Fibro is make sure that there's some sort of connection to an end. And I know with advocacy it's different, but I want you to know that how powerful you are to make a difference and connect the dots together. It's really important. And whether it be connecting you to a community of other advocates that you can feed off of and empower yourself and just ask questions. You may do a fibromyalgia advocacy with us, but you connect with a bunch of other people and other advocates, and then you start learning from each other about different things, just even managing your fibromyalgia. So I think that's an important piece of it. And just understanding that there's other things that you can take away from it, and you can meet people and connect with other advocates you haven't connected with in the fibromyalgia community. And I noticed that's really powerful as well. So if you are interested in getting involved with fibromyalgia advocacy, we'd love to hear from you. The team would love to hear from you. And we're looking for different people on different levels. So first of all, like training aspects. If you love training and you would like to deliver content, if you maybe haven't focused on fibromyalgia specifically, but you have done advocacy for and you'd like to present your tips and tricks, we'd be happy to have you present as part of the advocacy training. If you want to be a team leader and lead a team, that there's definitely positions available to do that as far as like time goes and training. Or if you want to be involved and join a virtual Hill Day, we'd love to have you join, and we'd assign team leaders to you this year and separate it out. And we work and we have other things like before the meeting, we'll talk through, and maybe you have questions regarding your story or the process. We go through that, and of course have the training materials that we've already produced, and we have some additional ones coming down the pipeline. So you can learn as much as you can. And then if you're not able to join the virtual Hill Days itself, we still need a rally, right? We need a social media rally out there. You can email your representatives, you can call your representatives, or you can even give out a tweet. Like, let them know that we're at Hill Days, and you can tweet them in social media. You can tag them all over social media and let them know that we're looking for their support for fibromyalgia. So there's so many different ways to get involved, and it's important because this is just different takeaways, and that's why I love seeing other people in fibromyalgia that joined the Patients Rising Advocacy Masterclass this year. Became a moderator for the group, so I get to see all the lovely faces, and I'm just so glad you've persevered. Right? There's so much to learn with advocacy, and it doesn't necessarily have to be fibromyalgia. There's other acts and there's other ways to get involved. There's other concerns we have. I mean, I know there was like a Social Security Act that came up. There's different things regarding Medicare. There's different things regarding prior authorization of medications. Something like if your family is affected or if you're a caregiver for someone affected, you can get involved on so many different levels. And I just want to let you know that we're trying to take down those barriers over here to make you feel comfortable and make you feel empowered, that you can learn as much as you want to learn. And we feed off of each other because that's important, right? We're sharing information. We're not hoarding it. As much information as I can share with you and teach you, I'm open to it. Or I can point you to other resources like the Patients Rising Network that has additional resources from people that have worked on the Hill. So we bring all of those together so that you can learn from the entire community and you can benefit from everything as far as your energy permits, right? So that's the program we're building. Hi, Kelly. It's so good to see you. Oh my goodness. Yes. You know what? I need to get back to ACR. My mind got onto advocacy. So we have joined Kelly at More Than Lupus at the booth at ACR. We're filling in. So this weekend, if anyone is attending as an advocate, please stop by the booth, leave your card, set up a meeting, and we would love to hear from you. It's fun. It's actually I'm like this just virtual connections is so great for introverts. If anyone out there is an introvert and you're loving it too, I'm loving it so much because you can just go to different things virtually and pop by different booths and leave your information there virtually. You can leave a card. You can follow people, you can send people messages and stuff. It takes, I'm noticing, a little bit less energy than when you're in person and you're trying to be like, hi, excuse me. And they're like, who are you? So this is nice because your bio is already set up online. So this is all part of it. And I think with the virtual meetings that we do for advocacy, you just kind of dress up on the top, be presentable, you'll have your camera on, and sometimes the representatives don't have their camera on. So they're talking through the phone, but it's just nice because you can move from meeting to meeting. And so those are some benefits for the virtual meetings that I love. But I just wanted to reach out to all of you because I had fibromyalgia advocacy on my mind. So if you are interested in getting involved, we are going to be doing a lot more next year. when it comes to some hill days. I'm considering 2 hill days or maybe one major one for strategy and then an additional one for more training, like people that really just want to start the process, want to start learning the process, but you're still going to be like matched up with your representative. So we're still going through what logistically makes sense for the organization, but we would love to have all of you involved. Please reach out if you're interested. And if you see like if you see other teams who like doing hill days and just have questions, you may not necessarily be ready to go with fibromyalgia advocacy, and that's okay. Just reach out to ask questions, and definitely we'll have conversations. We're going to be setting up some Zoom meetings to introduce you more to the process and the new changes that we're making over here as well. But thank you, everyone. Just have a wonderful low pain weekend. It's Friday finally. I think I mentioned on Monday I talked to someone and I was just like, "Oh, have a great weekend." And I was like, "Oh man, it's Monday." But now it is officially Friday. So have a wonderful weekend, everyone. Please catch us and follow us too. We're Kelly and at More Than Lupus and Looms for Lupus and Support Fibromyalgia. Follow us. We've been doing a lot more tweets from ACR. And if there is questions or comments you want or things you want to know more about from ACR, we will be happy to share. So thank you, everyone. I will talk to you soon. Bye.